Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the anticoagulants, their journal, overview of the anticoagulants, overview of blood coagulation, anticoagulant drugs, history of anticoagulant drugs, use of the anticoagulant today, prevention, future outlook. Next, first is the anticoagulants, general overview, drugs that help the prevent clotting of the blood. Coagulation will occur there are the interstitially once a blood vessel has been served. Blood begins to solidify to prevent the excessive blood loss and to prevent the invasive substance from entering the bloodstream. A blood clot consists of the platelets smashed into fibrin, a web-like accumulations of standard strands with RBC. There are the two major facets of the clotting mechanisms, the platelet and the thrombin system. First is the platelet, teeny cellular elements made in the bone marrow that travels in the bloodstream, waiting for the bleeding problem to develop. When bleeding occurs, chemical reactions change the surface of the platelet to make it activated and become sticky. First is the thrombin system. Calcium ion must be present for the thrombin system. To begin, the thrombin system consists of several blood proteins that activate when bleeding occurs. The activated clotting proteins engage in a cascade of chemical reactions that finally produce a substance called fibrin. Fibrin strands stick to the exposed vessel's wall, clumping together and forming a web-like complex of strands. Red blood cells become caught up in the web, causing a clot. First is the coagulation factor. Coagulation factor is the factor name are the fibrinogen, prothrombin, tissue factors or thromboplastin, calcium, proacylin, there are the proconvertin, anti-hemophilic A factor, anti-hemophilic B factor or Christmas factor. Factor 10 is the Stewart or the Stewart power factors and the plasma thromboplastin, anti-ascendant, Hagman factor, contract factor, fibrin stabilizing factors are the 12. There are the 13 factor is the fibrin stabilizing factor, pre-kallikrein factors, high molecular weight kininogens. There are the some coagulation factors. Next is the heparin. First is the heparin. Heparin is a naturally occurring anticoagulant produced by the basophils and the mast cells to prevent the formation and extension of the blood clots. Heparin does not disintegrate clot that have already formed. It permits the body's natural clot disease mechanism, that is the fibrinolysis, to work the normally to break down the previously formed clots. As the thrombokinase is released, it neutralizes the action of the heparin to allow the clotting to occur. Anticoagulant use. Anticoagulant drug help to prevent the development of the harmful clots in the blood vessels by lessening the blood's ability to cluster together. The functions of these drugs is often misunderstood because they are sometimes referred to as a blood thinner. They do not in effect thin the blood. These drugs will not dissolve clots that already have formed, but it will stop an existing clot from becoming worse and prevent future clots. In today's class, I discuss about the coagulation system, platelets, a blood clot, anticoagulant. Thank you for watching.